Thank you again for joining us today and being a part of our Heroes for Oral Health podcast. If you both wouldn't mind introducing yourselves and giving a kind of brief introduction to who you both are, your organization, and what you guys do for your organization.
Thank you. We're both excited to be here. I am Lisa Morvek, and I am a dental hygienist, and I work for the University of Nebraska Medical Center College of Dentistry, and I'm the site coordinator for the West Division program, and am really excited to be the primary investigator on this pilot project. And I have my colleague here with me today as well.
Hi, I'm Kelly Betts. I am the Assistant Dean of the UNMC College of Nursing in the Western Nebraska Division. I'm also a primary care pediatric nurse practitioner. And so Lisa and I are working together on this grant. We are integrating oral health into the primary care pediatric visits. And so that's my role, is the practitioner role. And we'll be talking more about that as we move into the podcast.
Awesome. Can you explain briefly the current landscape right now that your team is seeing with awareness and knowledge of the oral systemic link, particularly when it comes to pediatric care?
Yes, currently in my pediatric practice in a FQHC, which is a federally qualified health clinic, I see a huge knowledge gap in the both knowledge and awareness with patients in terms of the oral systemic link. Many parents come in with their infants and toddlers and they have not seen a dentist, nor do they understand the importance of seeing a dentist even before that first tooth erupts. Very seldom do you see a child that comes into the clinic that has been to the dentist under the age of 3 years of age. Just the other day, we had a patient that came in, a 14-month-old, and the oral history of this patient was so poor, and there was a lot of damage to the teeth. And I think that had this mother had knowledge and education regarding oral health and how it affects the body and the teeth, that maybe, some of the issues that the child had would not exist. And the bad thing about serving an underserved community is not only is there an education gap, but there's also an access to care issue. Many families don't have access to care for both medical and dental services. There are many uninsured patients, as you know. And so really and truly, in our community especially, it is a big problem. So with us being able to provide them with education and just a toothbrush, some children don't even have a toothbrush at home. So that's kind of the landscape that we see in our practice, Lisa and I, as of right now.
Why is it important to address awareness and knowledge of the oral systemic link during pediatric wellness visits?
Well, our project will focus on increasing the awareness of oral health by providing easier access to both medical and dental care, by helping children and their parents or guardians understand the connection of oral health and how it's related to their overall health. The impact of this project is immediate, as we are able to combine the medical and dental information into one visit. So this removes a barrier to care for both the parent and the child. It also raises the awareness of the oral systemic link and provides preventative measures to identify early dental needs. This allows us to refer to a dental office or a specialist sooner because we're able to identify the needs and get them directed to the correct practitioner to help them. So a lot of times we're not seeing them early enough to be able to prevent disease from occurring. So this change can cause that first dental visit from being preventative focused to being focused on disease that has already occurred. So we're trying to increase the oral health awareness and be able to focus on the preventative side of things and try and prevent disease from occurring.
You mentioned a federally qualified health center earlier. Can you briefly explain what a federally qualified health center is and why this is such a good fit for this project?
Absolutely. A federally qualified health center is a community-based health care provider that receives funds from the U.S. Human Resources and Service Administration Health Center program to provide outpatient clinical services to underserved or unserved areas. So FQHC is an acronym that is commonly used to abbreviate or stand stands for a federally qualified health center. Our project, we are collaborating with a FQHC in rural Western Nebraska. It is the Community Action Partnership of Western Nebraska, which is a federally qualified health center that is part of a national network of organizations that provide care across America. FQHCs are nonprofit community-based organizations that serve low income and those unable to meet their needs through other sources. So there's federal funding to help engage in getting treatment services for patients that otherwise wouldn't have opportunity to be seen. So Community Action Partnership of Western Nebraska that we're partnering with was established in 1965 and provides programs to over 8,000 individuals, children, and families in the community. And our University of Nebraska Medical Center dental hygiene program has actually been seeing patients in the last 15 years out of this federally qualified health center. And I can tell you we service the entire panhandle of Western Nebraska and have patients that travel from surrounding states. So there is definitely a need, and it's a large service area that we provide treatment needs to. So this highlights why integrating oral health awareness into the medical well child visits is going to help remove a barrier and increase access to care. Additionally, just some special demographics about Community Action Partnership of Western Nebraska. In 2017, the data showed that 78% of the population is at or below the federal poverty level, and 40% are Hispanic, with 17 of those that have noted that English is listed as a second language. So 97% of them prefer Spanish as their primary language. And this is important to note because this shows that our program is going to support an at-risk population and is truly a great fit for this project. Definitely going to have a huge impact on the community in a large service area.
You've kind of explained the project here and there briefly. Can you expand on this specific project, kind of go into detail how it works and how you plan to use this model to serve this need?
So this is a study to look at the feasibility of a new delivery model, and the project will focus on increasing awareness of oral health, providing easier access to the care provider, and then helping the children and their parents understand the connection between the oral hygiene to oral health overall. It will be a collaborative and integrated approach to care delivery between the dental hygienist and the nurse practitioner, or in other instances, it might be a physician or a physician's assistant, but it will take place at the Community Action Health Center in Gearing, Nebraska. And basically, the project will also include both dental hygiene students as well as nursing students from UNMC. And basically, what we're doing is we are integrating both the assessment of oral health into a normal well child check. So when children come in for their visits during childhood, let's say at 2, 4, 6, 8 months, and then 12 months, 15 months, and then at each year, they will actually have a very extensive oral health assessment as part of that delivery of care from the provider. So it's really a collaborative effort between both parties, and our students are involved so that we are teaching them interprofessional education and how important it is to understand the various roles between students as they get out into the real world and start practicing after graduation.
I'd like to just add to that that we've already started seeing patients, and we're able to, during that pediatric wellness visit, be able to talk to them not just about oral health, but we've also been able to talk about normal eruption of teeth, so that as teeth are coming in, the dietary and nutritional counseling to make sure that we're incorporating that in the visit, and adding oral hygiene instruction in addition to providing them with a toothbrush and toothpaste so that there's not an access to care issue there.
What would you say your team is most excited about for this project?
Well, I am extremely excited with the support of the DTA Foundation that we've been able to see this vision that we had become a reality, already starting to see an impact with the few children that we've began seeing in January and February, and really do think we're truly making making a difference in increasing their awareness as well as increasing access to care by integrating the medical dental model that we've been using. And in addition to that, it's been a great interprofessional education.
It has been. I think for me as a nursing educator, it is so exciting to be able to teach students how to interact with each other interprofessionally and understand, like I said earlier, the roles that each healthcare professional plays and how in many ways interprofessional education in all disciplines at some point in time tends to come back around and everybody tends to overlap in some ways. So for me, it's being able to increase the students' knowledge and them taking that knowledge into their professional world once they're graduates and being able to work with others in the healthcare profession is extremely important. And, the second piece to that for me, obviously, is just being able to integrate another type of assessment that is so important into the child visit and making sure that the child is looked at from a holistic perspective, especially when oral health is involved.
Due to our geographic location, much of Nebraska is very rural, and so having an opportunity to provide this program through the DTA's support, as well as the support through the University of Nebraska Medical Center and the Federally Qualified Health Center and Community Action Partnership, we really are making a difference in an area that otherwise would have barriers that a lot of parents would not be able to overcome. So I think that's exciting in itself.
And we'd like to once again thank DTA so much for giving us the opportunity to do this study and look at the outcomes in hopes that once we figure out the logistics of doing it, that the other healthcare providers in the Community Action Health Center will pick up the model, integrate it, and that we can just make this work within many different clinic settings going forward.
Thank you. And again, thank you so much for taking the time to speak with me today.